There we go. 9:23 is the time. News Talk 1270 KIML, the radio station. My name is Glenn Woods. Thanks for joining me. 682-1270, the phone number, 307-682-1270 if you're outside the area code. There you go. Sit up a little bit so I can see you a little bit more. Okay. How you been? It was good to meet you in person as well. And this is where I said to Maureen just a moment ago, I have been busy this morning, so I'm forgetting where the topics are. So your topic from Wyoming Liberty Group is?
Healthcare. We have a couple of bills. I wanted to bring the citizens up to date on what's going on there at the legislature and maybe what can come out this session. I'm hopeful. I'll put it out. Start us off that way. I am hopeful.
Hopeful as to why? What has got you hopeful?
Well, what has got me hopeful is two things. One is that we're getting some good debate, good discussion on the importance of allowing people to purchase insurance across state lines. There is a bill that we don't support entirely. It's House Bill. The title of it is Interstate Sales of Health Insurance. It has all of the requirements of the bill that we liked in there, but it adds some extra regulatory things on outside insurers that I think will probably deter them from offering plans. So in other words, the net gain may be a zero, but they're truly looking at and understanding how essential and important being able to combine risk pools across state lines and allowing small groups and individuals to eventually join together to produce a product that is affordable and meets their needs.
Well, that's important,
where we're at with that.
Here at this radio station, I recently dropped my health coverage because it was just the price just went through the roof to the point that I said, I'm not paying that. That's just ridiculous. No way. So would this actually offer me some kind of an affordable health care plan? It would be outside of my employer, but maybe I could go ahead and buy something across state lines.
Well, it against that process, but here's the but. It still focuses on competition from insurers on the outside. It's still, the focus of this bill is saying we want to make sure that any insurer that's going to be coming into Wyoming to offer plans, we want to make sure they do it exactly like the plans that we have now. And we know those plans are not affordable and they don't meet our needs. They're loaded up with all kinds of things we just don't need. So that's where the emphasis is wrong. And I am concerned that even though we're saying, okay, go ahead now and allow people, the Wyoming people, to purchase these plans that outside insurers can bring into Wyoming, you know, we should therefore give them more competition and more options. I don't see that happening because, again, the emphasis is wrong. Our bill, the one that we wanted, House Bill 125, was an excellent bill. It focused on what we should be focusing on. It says leave all the insurers in their own state, leave all their rules in their own states, allow Wyoming people to go across the border and purchase a plan, join that risk pool, and begin to, because of the consumer demand, begin to develop the plans we want. So if you can see the difference here where House Bill 82 is still focusing on insurers coming into Wyoming, that isn't going to get us anywhere because they're just going to be bringing in the same stuff that doesn't work for us.
Well, and I think part of the problem is, here's where I ask you to get into the head of a politician, so you might want to take some aspirin before I finish this statement here. But what is the major malfunction that these people have to get involved in my business? Why can't I, as a big boy, and I am a big boy, that I can go out and choose what kind of insurance I think I need, and it's my choice to take the risk that I want to take if I choose not to purchase insurance. But even here in what's supposed to be the freest state, Wyoming, we have the politicians and bureaucrats trying to dictate to me. I'm sorry, it drives me crazy.
Yeah, you know, exactly. House Bill 82 does. As a Wyoming citizen, it offends me a bit because now they're coming up with these big, huge warning signs that they want to put on these policies. Warning, you're now crossing over into another territory. You may not have all consumer protections. And I'm sitting here going, wait a minute. We are intelligent. I mean, we have to negotiate mortgage contracts, for crying out loud, and no one would tell you buying a car is simple. So, we learn from each other. We've learned from our relatives in other states that they may have a better insurance product. We are more than capable. Well, our legislators, bless their souls, and I believe that they just truly want to make sure that there are no negative ramifications. They still believe that they need to protect those of us that are not capable of discerning policies. The truth is, we all discern policies, and we don't go to the regulators. We don't go to the insurance agent. We go to our neighbor next door and says, hey, how's that policy working out for you? We know exactly what we want to know. Does it do this, this, this? And they say, well, this wasn't so good. And then we can say, oh, I can live with that, no problem. So we'll go buy it. Proof is in the pudding, and you can't protect us from that because that's part of the free market. And inevitably, when you try to protect us, you interfere with the development of a good product.
Okay, so there's some good news and there's some bad news on the healthcare front in the state of Wyoming. I guess that's the moral of the story, huh?
Yeah, we're moving forward. And the next thing I'd like to talk about
I hate that phrase, moving forward. Thelma and Louise were moving forward, upside down, bottom of a cliff, car on fire. But anyway, what's the other thing you wanted to talk about?
Okay, well, let me put it to you this way. We are heading up a stream in the right direction.
Okay,
we don't have one rudder.
Yeah, it's a good visual. Thank you.
We're going. All right. So the next thing that they're really debating about and hung up on is still wanting to keep the fingers in the exchanges. They want to study this thing. And again, Wyoming legislators have to realize that it's okay. We can monitor this process. We have to, because the the Supreme Court ruling said every state's going to have an exchange. Now, we know these exchanges are not going to produce what the federal government has promised us. So the legislators wanted to keep their fingers in that process. Well, unfortunately, it's not going to do any good because the federal government still has to provide all these rules and regulations on how this thing is going to work. They have to do it for the federally facilitated, and they have to do it for the partnership, state partnership exchange. So until those rules are out there, in other words, until Secretary Sebelius knows what she's doing, the state of Wyoming can't know what we're doing. So, I'm a little ambivalent about the bill, but I'm going to give it to them. I'm going to say, okay, fine, just, you want to keep involved in it, that's fine. I just don't want anyone to put in a grant that Sebelius down the road, which she has the authority to, this law has given her tremendous authority to mush things up. I don't want any grant to be written that's on the face right now. It's like, no, just go ahead and plan, and then she changes it up and say, oh, by the way, you'll get the next set of money when you commit. They give us the double whammy, and that is entirely probable that they will
and to give credit where credit is due, isn't that part of the reason Governor Meade opted out at this point with Obamacare, because he looked at it and said, well, we don't know what Kathleen Sebelius is going to do next.
Yes, absolutely. Very wise. It's very wise. And let the federal government spend their money putting this thing together, because at the end of the day, they're going to have to verify that Wyoming's exchange is self-supporting. That means they're going to have to verify that all the employers out there have enough money to cost shift into these subsidized plans, and everybody's going to be happy and the care is going to be affordable. Now, you can already see that isn't going to happen, especially if you're going to keep every state's risk pool the same small size it is now. It doesn't work now. How on earth are you going to make it work when you're shifting more of the cost from the private sector?
Right. Okay. All of this information, is it also up on Wyoming Liberty Group's page, so you can go ahead and people can go ahead and take a look at what the research you've done?
You bet. There's two publications I'd like to draw their attention to. One, of course, is the 5-step plan. And so far, Wyoming is looking at it. Other states are looking at it, because it does give you a very broad idea of where things went wrong and what we need to do to correct it. So Wyoming is headed in, again, that right direction. Then the second thing is that I posted just a quick little talking points document on House Bill 82, why I believe it's not going to get us what we want. But then again, at least we're putting it out there, and we can say to the other states, hey, this is what you need to do, folks, because you're not going to have an affordable exchange in Montana, in Arizona, in California with your hundreds of millions of people. It's not going to happen. So eventually, people are going to look and they'll see that, wow, Wyoming did have this right. They did research it, and they understood exactly how this whole federal minutia is going to operate when it hits our front door. So those are the two good things. And I will be publishing another brief on exactly how all of this stuff comes together. It's going to be called A Citizen's Guide to the Federal Health Care Act. It will also involve employers, but I'm going to pull it together so people can understand the fact that health insurance is no longer going to operate for them the way they want. And I'm really concerned that people don't understand what's going to happen to them in another year when these things hit.
Well, here's what I'm going to do to help out. Then I got to let you go and pay some more bills. But I've been sick. I can honestly say government made me sick. While I was down in Cheyenne, I got sick again. So government made me sick. I am going to take down one of my pages on my website, and I'm going to put a Wyoming page on there. And part of the information I'm going to steal from the Wyoming Liberty website. I'm going to put up some of your videos, some of your articles and link. Okay. But I've already posted a link to Wyoming Liberty group on my Facebook page, but I'd like to kind of merge the two. So as you guys have articles that you would like to feature, I'll hope to have this up sometime this afternoon if I can. Let me know what you guys would like to feature, and I'll go ahead and put it on that page, and we can exchange some information and spread it out to the public, because, I mean, you guys put out some great articles, but I don't think it gets the exposure that it really needs.
Well, thank you. Yeah, we appreciate that. And we get tremendous feedback from people. Look, they said, this all makes sense. Mm-hmm. And when you have it explained to you the way it's going to function,
the
way it functions, and I can do that. I can take this federal garbage in black and white and put some functioning to it so people understand how it's going to hit them.
I'm really impressed with the way you edit your language when you're on the radio. That's very good. I do appreciate it. Always good to see you. I got to run and pay some bills. Thank you for coming on, as always.
You bet.